You've survived cancer, had your chemo, now in remission, you're feeling good, but now you're having hair loss and you're wondering, I think it's time for a hair transplant. Now I want you to stop right there. If this is you coming across this video for the first time, thinking about a hair transplant after everything you've been through, I need you to sit right here and watch this video to the end. This video will save you a whole lot of stress. Now, if you're coming across this video for the first time, my name is Dr. Chefu. I'm a hair transplant surgeon and a hair loss coach. I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. Now, I've had a lot of my clients, cancer survivors, coming to me wanting a hair transplant. And once I take a look at their hair, talk to them, I always have to tell them that I don't think you need a hair transplant. They're always sad about me telling them they don't need a hair transplant, and they're always wondering why don't I need a hair transplant, and when can I get a hair transplant? They ask me all these questions. I'm going to be giving you 4 recommendations on what to do before you think about a hair transplant. Now, if this is you listening to my voice today, I'm going to be giving you 4 major things you need to do before you think about a hair transplant. Number 1 is always to make an appointment to find out what is going on, and we offer free virtual appointments. Make an appointment so someone from my team will talk to you and find out what you're dealing with and how we can help you. And now this leads me to my second point. There are 2 types of hair loss when it comes to chemotherapy. There's transient hair loss, which usually happens around 2 weeks of initiation of chemotherapy. And typically we tend to see you regain back your hair after a couple of months. Now, the second type of hair loss is called persistent chemotherapy-induced hair loss. What does that mean? You're having permanent hair loss from chemo. That's just what it means. And we typically tend to see that the hair doesn't really grow back after that. So if this is you, what is the time frame? Are you still getting your chemotherapy, or you're done, or you're in remission and you're still waiting for your hair to grow? So you need to have a proper scalp and hair evaluation to know where you fall into, which category you fall into, and how we can help you. Now, my next point is medical treatment. You might need to start on some form of medical treatment. There are not a whole lot of medical treatment when it comes to persistent hair loss chemotherapy, but minoxidil has been proven to help some when it comes to chemotherapy-induced hair loss. So if this is you, talk to your hair transplant surgeon, talk to your dermatologist, talk to your primary care doctor. You can start minoxidil as soon as possible. And this leads me to my final point. You need to give yourself time. I know you are going to say, hey, Dr. Chefu, I've been dealing with this for 2 years, 3 years, 4 years, 5 years. Yes, but you need the right guidance. And that's why I always say the first step is to make an appointment. The second step is to know what you're dealing with. The third step is to start on the right medication. Then you go from there. And now if you've watched this video to the end, I'm sure you must have enjoyed this video, and now you understand what is going on with you. Now, so before you think about a hair transplant, make sure you think about all these 4 things I've talked about. Now, if you know someone dealing with hair loss, or you think their hair loss might be from the chemotherapy they had back in the day, send them this video. This video will save them a whole lot of stress and thinking. I need you to head over to YouTube. YouTube name is Dr. Chefu. I teach you simple tips and tricks when it comes to hair transplant and hair regrowth. You can make the appointment for them so that they can talk to someone from my team so that we can find out how we can help them. Now, I want you to stay safe. Until next time, bye-bye.